Hello guys, today we're going to be talking about the side effects of Botox cosmetics, not just any kind of Botox. But first, before we start, please hit the like and subscribe button. Side effects of Botox that we're going to be talking about today don't just range from one certain medication. They can come from medications such as Dysport, Xeomin, and many others that are across the market in the US and internationally. Botox removes dynamic wrinkles that occur in the face. So when you're moving your face, up and down with your eyebrows, that's what dynamic wrinkles are. Any wrinkles that occur when your face is just resting, Botox cannot remove. Botox works on nerve endings that inhibit the production of acetylcholine, which also inhibits the contraction of muscle. One rare side effect of Botox is headaches. They're really, really bad. So with this, they typically last between 2 to 4 days, but Tylenol really helps. Another rare side effect that Botox has can be dizziness. Dizziness is also pretty rare, but only lasts between an hour to a day. Now we're going to move on to the common side effects of Botox. Number 1, local allergic erythemas, which is just generally facial redness. This can last as little as a couple hours to as many as few days. And with this, people generally use antihistamines and even corticosteroids to help combat this redness. Number 2, local swelling. This generally occurs around the injection site right after being administered Botox. Although there are no medications to help with this, administering ice and keeping it cool does help. Number 3, bruising. Bruising typically occurs around the eyes when Botox is administered and lasts between 3 to 7 days. Arnica, a cream, generally does help. One rare side effect of Botox is headaches. They're really, really bad. So with this, they typically last between 2 to 4 days, but Tylenol really helps. Number 5, erroneous muscle movement. This is generally described as Mephisto-facial-like. Who's Mephisto? Mephisto is generally the right-hand man of the devil, and it's known that his eyebrows are like this, which is generally what the muscle side effect becomes. Number 6, eyelid ptosis. This generally occurs when the provider is at fault by coming too close to your orbital rim. The doctor would inject it right near your eye here, which causes droopiness within the eye. You can have mild cases all the way up to severe cases. Generally, this lasts within a couple weeks, and certain eye drops does help. Number 7, eyebrow ptosis. This generally is the same as eyelid ptosis, where the doctor does come near the orbital rim and injects it right near the eyebrow, generally within 1 to 2 centimeters, and this causes your eyebrows to stay in this sort of position and just start to droop. Doctors initially need to do a screening first because if patients, such as the one seen below, have generally lower sitting eyebrows. Number 8, frozen forehead. This generally is up to the patient themselves because people with typically frozen foreheads do not want to have a moving forehead. They want it to stay completely still. And so with this, it's generally up to the patient. Number 9, double vision, or more commonly known as diplopia. This generally occurs when the doctor injects too close to the side of the orbital rim, and with this, the Botox diffuses within the eye, which causes your double vision to occur. With this though, if you cover one eye, patients can generally see fine, but with 2 eyes, that's when double vision occurs. Although this side effect is not permanent, it does last within 2 to 3 weeks. So just remember, double vision. Number 10, asymmetric results. This generally occurs when the doctor is injecting Botox more on one side than he is on the other side. So as seen with the photos below, on the woman on the left-hand side, there's more Botox injected on her right-hand side than there is on her left-hand side, which causes this asymmetric result. As seen also on the woman on the right, she's more skewed to the left-hand side. So with Botox, providers need to know to inject the same amount of Botox on each side of the face for the asymmetric results to not occur. Number 11, infection. Infection generally occurs after the injection of Botox within the skin due to the skin not being cleaned properly. With this, we generally have to make sure that the skin is cleaned properly, generally with alcohol, for you to prevent infection from occurring. If it does occur, the typical treatment is antibiotics. Number 12, neutralizing antibodies. Neutralizing antibodies occurs when Botox is injected within a short time frame of each other, within a 3-month period, that allows for Botox to not take in the effects that it should have. So it weakens the effects of Botox when you're injecting it within really short time frames of each other. Thank you for watching this video. If you guys want to learn more about medicine and any other side effects, please don't forget to hit the subscribe button and drop a like. Bye-bye. My name is Leah and I'm with Akl MEDICAL.